Hi, we are in the dental room here at O today rather than in the skin room for this video, and this video is to give you a bit more information about what is the airflow, what am I actually talking about when I'm talking about this airflow polishing and the hygiene visits. This is what the monthly membership plan entitles you to 4 airflow visits per year, which we recommend every 3 months that you come in for an airflow treatment. Visiting the hygienist isn't just about clean teeth and healthy gums. The mouth and gum disease is related to so much of systemic disease. So when you have your mouth cleaned, especially with an airflow type cleaning, we are actually preventing gum disease, but we're also preventing heart disease, diabetes, stroke, erectile dysfunction, low birth weight babies, premature babies, some cancers, the bacteria that builds up in the mouth, and when we have inflammation in the gums, gum disease, that bacteria can travel in different ways into your system. It can get directly into the bloodstream from the inflamed gums and travel to different parts of the body. With the link with Alzheimer's, the bacteria in gum disease has 2 routes. It can travel in directly in the bloodstream, where it hops on the red blood cells and uses them as a transport mechanism to travel round and into the brain. And the other way is it can climb up the nerves from the roots of the teeth and travel through the nerve system up into the brain. There is a blog on my website which explains a bit more about these links and has some clinical studies quoted on there, referenced on there rather. We've known these links for a long time, and the links with diabetes as well. So having your teeth cleaned every 3 months isn't only about appearance and the cosmetics of having nice clean teeth or nice white teeth, removing stain, and having fresh breath, confidence. It's also about your whole health. The airflow differs from the old type scrape and polish because with an airflow treatment, we're removing the microscopic stuff, we're removing the biofilm of bacteria. Airflow is now also commonly known as guided biofilm therapy, GBT. They're one and the same. So when we're treating the tooth and we're cleaning the tooth with airflow or GBT, we're not only removing what you can see, we're also removing that sticky invisible layer of biofilm, which is where all the harmful bacteria is and where the links are with gum inflammation, gum disease, and all the other systemic diseases. We do advise it every 3 months that you would come in. That's why the membership plan is set up that you pay £20 a month, direct debit. You get your 4 airflows per year for that, so you're spreading the cost, saving money on the pay-as-you-go price. Now, what is the airflow? Well, the particular device that I use and have used since 1998, I think I first used this machine, showing my age, is this. It's called a Profimate, but this is the piece of equipment. So these are the parts that, they're detachable, they get sterilised in the sterilisation room. Everything is as it should be. We add powder to the chamber, and then it gives me a mix of air, water and powder to clean the tooth surface. Because of that, we use a suction to catch any of the air, water and powder that's coming off of it. So it's not a quiet procedure. We do use the suction, but it's really gentle. It's really effective. It's leaving the tooth completely clean. We're resetting everywhere in the mouth. Your tooth is the only non-shedding surface in your body. Everywhere else in the body sheds. Your hair sheds, your skin sheds, cells, everywhere sheds, and almost has a kind of self-cleaning effect by its shedding effect. But the tooth doesn't shed. And as it doesn't shed, it's the perfect surface for bacteria to colonise on, to grow on, to create little ecosystems for itself where it feeds and it creates little toxins. So we do have to be removing it. and you can't always do 100% effective cleaning at home. So this is where the airflow also catches up. It's giving you a full reset for you to start from fresh. I combine the Profimate with Flash Peril powder. There are different powders that can be used in an airflow or GBT cleaning session. The Profimate and the Flash Peril I've always favoured. We do have leaflets in here. This will also be on the blog about why choose an airflow. But it's spherical particles of powder which are rolling over the tooth surface, and it doesn't cause any damage. When we're cleaning with the Profimate, we're keeping the tooth really healthy. Some of the old methods of polishing were a bit abrasive, and every time we polished the tooth we were just removing just little tiny bits of enamel from the tooth surface, little microns of enamel, but we were being slightly abrasive. So we're trying to move away from that now. Everything's about prevention, being minimally invasive in any type of dentistry these days. Anyone who has had an airflow polish, you'll never get a clean feeling like it again from any other polishing system. Once you've had airflow, rarely will anybody ever go back to having a normal scaling polish with the old brushes and the paste, or the little rubber cups and the paste. It really does leave your teeth feeling amazingly clean, leaves your mouth feeling amazingly clean. So I have my little Oral-B model here. This is what I usually use to show how to use an electric toothbrush correctly and stuff. So I'm going to do a wee quick demo just with this. Probably make a little bit of a mess here. Normally when you come in for this, I would have one of my dental nurses at the side of me, so there would be 4 hands instead of 2. But I just want to show you what this is like. It's just a fine spray that comes out. It's just the spray that's touching the tooth surface. This isn't actually touching the tooth surface. It will be a little bit noisy because I'm going to use my suction, but this is what would happen during a no airflow. So hopefully you could see that there, but it's just a fine jet of water that's coming out and taking everything off the tooth. It removes stain, fantastically removes stain, removes every tooth surface stain, any tooth surface deposit it's removing. This will take everything off and leave your tooth in its natural state and its natural colour. It will remove tartar. It removes tartar, it removes the plaque, the biofilm. I do normally combine this with another piece of equipment, which is a little ultrasonic scaler. That creates bubbles of oxygen which are taken down under the gum, and it almost massages the gum and gets rid of the harmful anaerobic bacteria, the harmful stuff that sits under that gum margin. But we can just airflow on its own. That would be something that would be discussed when you came in for the appointment. But that's how easy and simple it is. We basically move around the whole mouth, cleaning the surface of the tooth. I have some before and after pictures of patients who have actually been in it all, who have allowed me to share the photographs of their mouths, and I will put that on to the blog about why choose a no airflow and the effects of the before and after. There are a few recommendations written by patients who have recently had a no airflow. They are on the Facebook page, and so you can read about their experiences there. And that might give a better insight than me going on about how fabulous my treatments are. You can come and see me if you're registered with a dentist, or if you're not registered with a dentist. Since May 2013, hygienists have been granted direct access, where we no longer work under the prescription of a dentist, and we can work solely direct to you. So you can choose, you get a choice of coming to us, and you can choose to come to us for preventative treatments. you're not cheating on your dentist by coming to me. You can still see your dentist, and I would advise that you still see your dentist. There's a lot of treatments that I don't provide, and if you're not registered with a dentist, I have some fantastic dentists that I can refer you to for other treatments that I don't provide, who I can vouch for, that are top notch, and really listen to you. But we can take care of all your preventative side of things. And in the very beginning stages of gum disease, tooth decay, and even in the more progressive stages of gum disease, we can reverse it. So I can do treatments that can reverse it. We are working on promoting health and preventing disease when you're coming into EO. So there's lots of stuff that I can do. So whether or not you're registered with a dentist, not registered with a dentist, haven't been for years and years. I have many patients who it's been 10 plus years since they've been in a dentist, or even, had their teeth looked at by a dental professional in any capacity. That's fine. That's what I'm here for. I am here to reset you and to give you your best mouth health and your best smile, really. So that's my job. I want you to come in. I want to clean your teeth. So don't be embarrassed if it's been years and years, or you think, I can't go in there. My teeth are too bad. That's what I'm trained for, and it won't be as bad as you think. I've worked in all manners of dentistry, including over in Uganda, in rural areas of Uganda. So you're not going to shock me. Come in and let me clean your teeth, and let me educate you on how to do the best things for you. Anyway, I'm rattling on again. Check out the blog. If you are wanting to come in for a look around, give us a phone and come in for a wee 5-minute chat and have a look around the place. See if we are for you, see if we fit. Come in and check out that we don't smell like a dentist, as people keep saying. You don't. Patients that come in always say, "Oh, you don't smell like a dentist." So come in and see the place, experience what it's like before you book in, if you like, and I can show you everything that we do in here. I am at the end of the phone. You can catch me at any time. Don't think I'm too busy. If I'm not manning the phones, one of the receptionists will grab me to have a chat with you, and you can always message me through the website or through the Facebook page. So don't be a stranger. Everyone should be coming in for hygiene tooth cleaning, regardless of how clean you think your teeth are or how dirty you think your teeth are. You should still be coming in for regular cleaning. So check us out, check out the membership plan, and give us a call.